that leaderboard, you have to engage inside of the Hoover app. So remember that if you want to be on the leaderboard and win one of the prizes for the leaderboard, you must be engaging on the Hoover app. So we are going to get started. Hello, everyone, and thank you so much for joining us. Now we have for chronic pain, overcoming disparities with an invisible disease, Miss Pat Corley. For more than 40 years, Miss Corley has committed her life to service, advocating and for providing high quality care for patients most in need. Ms. Corley began her career working at several different hospitals, exploring a variety of fields in nursing, including medicine, orthopedics, ICU, mental health. After a few years, Ms. Corley accepted a staff nursing position at the Los Angeles County University of Southern California Medical Center. This decision was in essence a statement of confirmation of her values to use her skills and talents to serve underserved low-income patients. Ms. Corley's performance as a staff nurse was quickly recognized leadership, and she was promoted to nursing manager in mental health. So, and Ms. Corley is a very proud advocate in the sickle cell community for over 20 years. So without further ado, Ms. Pat Corley. Hi, Ms. Pat. You're muted.
Hi.
How you doing? You look so lovely.
I am doing great. I'm glad to be here. I'm always in the presence of family when I'm at one of these meetings.
Yes.
You know, so it really gives me honor to be listened to and believed in regards to my experiences and to the experiences of other folks living with sickle cell disease who sometimes aren't listened to.
Oh, well, thank you for being here. So take it away.
So we're going to talk about sickle cell disease, basically. And we're going to talk about one of the terms that I've heard very often by Adrian Belcourt Shapiro is that we're in those between times. We all know that there are a lot of things that have happened over the last few years that have placed us in this between time. There are new drug therapies. There's gene therapy. There is bone marrow transplant. There are just a lot of things that are going on that are hopefully going to make us ultimately better in the long run and help us to help folks living with sickle cell disease live in a very different way. So that's a term that I really like, because it offers hope for you as people living with sickle cell disease to live your best life ever. So there's more attention to sickle cell disease than ever before. We now have hydroxyurea, we have Endari, we have other drugs in our toolbox, our tool chest, that are going to prepare us to live a better life. There are 45 drugs in the pipeline, at least 45, to decrease the effects of damage resulting from sickling and poor oxygenation. There's bone marrow transplant, like I talked about, genetic engineering and stem cell as a treatment, and potential cure options, although currently we don't have a universal cure for sickle cell disease, but we're certainly moving in that direction. But most importantly, we have support of national organizations, and I'm going to mention my organization first, like the International Association of Sickle Cell Nurses and Professional Associates, the FDA, the NIH, the CDC, WHO, CMS, and many others who have finally come to the forefront supporting us as we fight the fight to ensure that people with sickle cell disease get exactly what they deserve, the best possible care, and eventually a cure from sickle cell disease. All of this does require money. There's some pouring in of some money that's allowing us to do some of this work. I left out an organization, which is the Hematology Association, which is also entrenched in this fight for better care and services for people with sickle cell disease. And there is a shift on the focus of how important sickle cell disease is. Before, we always felt like sickle cell disease was kind of an orphan disease that no one really cared about. We now know that there's much more support being given to us as people in the sickle cell community, and hopefully that will translate into a cure and better services for people living with sickle cell disease. So, oops. I don't know what happened.
Can you see?
Now I can see. Okay.
Okay.
So we also know that with sickle cell disease in the past, we've had the worst health outcomes. We've had fewer health resources. We have had high rates of readmission to hospitals because people just didn't listen to folks with sickle cell disease as they tried to explain what was going on with them, and they were discounted often and not given the services that they need. We know that 70% of the doctors don't take Medicaid, and so patients aren't able to engage them in taking care of them. That there's continued stereotyping of patients as drug seekers and drug addicts, and the belief that they have an addiction problem. We also know that there have been things that have come out that even though the epidemic, the opioid epidemic, came forward, we were also designated as one of the only groups that should not be included in that. But when we looked around, we're in the trenches of fighting against being accused of opioid addiction and being denied medications for people living with sickle cell disease. I think what was meant for good has really put us on a course where we're having to fight harder to ensure that people with sickle cell disease do get what they're needing. So there's poor pain management. We know that even though patients come with pain plans, oftentimes they're not regarded and respected. They're dismissed, and people try to treat them in the way that they think would work best for them without really being as knowledgeable about sickle cell disease as the people who actually design their pain plan. We know that there are poor service and long waits in the emergency room and for care overall for sickle cell disease, and that it's very difficult to find physicians who actually know sickle cell disease or who are actually willing to take care of people with sickle cell disease. We know that there's a lack of evidence-based care and that there are poorly trained providers as it relates to sickle cell disease. But I think an important thing that we do realize is that we are now, even though we're plagued by all these health disparities, we also have people who are in the trenches who are fighting for people with sickle cell disease and who believe that people with sickle cell disease do matter and that what they say has value, and so hopefully we're moving forward as we are embracing, as we're moving people toward embracing some of the things that patients with sickle cell disease are experiencing. Next slide, please. So Dr. Martin Luther King Jr. years ago, said of all the forms of inequality and injustice in healthcare is the most shocking and inhumane. And we all know that because when people with sickle cell disease show up, they usually show up if it's not at their usual care places like their clinic visits or things that have been ordered for them, they show up in the emergency room. And when they show up in the emergency room, the disrespect, the disregard, the discounting that happens in those emergency rooms is ridiculous. And so Dr. Martin Luther King, even though he wasn't just speaking about us as a community where sickle cell disease lives, he was sharing our reality that inequality and injustice just should not be present in the healthcare system. So sickle cell pain, there are different forms of sickle cell pain. There's acute pain, and that's pain that comes and it lasts for a short time. 50% of the adults have pain every day, and then we have children who have pain 10% of the days that they're living. Yeah. We have chronic pain. Like I said, acute pain is the short acting pain, the pain of a vaso-occlusive crisis or something else that's going on with the person that doesn't last very long. A chronic pain is a different picture. With sickle cell disease, we know that because blood goes to every part of the body, there is potential for damage to every organ in the body. As a result of the damage, people with sickle cell disease ultimately wind up with chronic pain. They wind up with things like avascular necrosis to the hips, to the spine, to the shoulders, to wherever blood goes, that you have potential for having chronic pain. And chronic pain is long lasting pain, and we'll talk more about that. We also see neuropathic pain, and that's nerve pain, and that pain a lot of times is caused by the medicines that you have to utilize. But you also have neuropathic pain or nerve pain, and that pain is a burning sensation kind of pain, and we will also talk more about that. But I think there's a pain that I didn't mention. It's the pain that people with sickle cell disease and their families suffer from living in the midst of all the controversy related to sickle cell disease. It's the pain that takes people out of their usual functioning places, going to work or doing other things that they need to do that we don't often talk as much about. It's the pain of trauma, PTSD as a result of having sickle cell disease. It's the pain of just living a life that is inhibited in many instances because of sickle cell disease. And so that's the pain that we often skip over when we're talking about, because we're talking about physical pain. But I think we also have to talk about mental and emotional pain as well. So acute pain is a sickle cell painful episode. And for those of you who are on the call, either having sickle cell disease or being a family member or a care provider of people with sickle cell disease, you know what acute pain looks like, how it shows up in your particular environment, and what you have to do in order to get relief from it. So sickle cell acute pain is usually episodic. It comes and it goes. It's highly variable with each person. It's hard to just describe acute pain and describe it where one box fits all. Most patients have their own personal pain pattern, and we simply have to believe them. Margot McCaffrey, a nurse who really coined what pain is, said years ago that pain is whatever the person says he has or she has, and it exists whenever they say it exists. But most individuals living with sickle cell disease have a pain pattern. It's unfortunately, acute pain is elusive in nature, which means that it's really, really difficult to describe. It's really, really difficult for people to get a hold of what you're saying. And if you've never had pain and had really bad pain, it's very difficult for you to understand what it's like to have an acute pain crisis or an acute pain episode. It's usually not life-threatening. It comes, it lasts for a period of time, and it goes away. And if we did absolutely nothing with treating the pain, although people would suffer profusely, eventually that pain, as it worked through the system, might be lessened or might even go away. Less than 1% of our population has a problem with drug addiction, though we're treated like everybody who has sickle cell disease has a problem with opioids. And there are efforts being made to change patients over from opioids to other medicines that healthcare providers think might work optimally for managing sickle cell pain. But my feeling is that we need to listen to the patient, listen to what you tell us, and that we need to move from there. And if you are agreeable to trying something different and you try something different and it doesn't work, you should still have the opportunity to take the medicines that work for you. Most patients manage their pain at home because they don't want to see those of us who are in the hospital setting. They don't want to go through the trauma of having to engage with people who don't believe what they say and who don't endorse what they say. And they're coming to the hospital only when they're only coming to the hospital when they're in severe pain, because they still want to be able to work, they still want to be able to live, they still want to be able to manage their pain in the best way possible. And so with having acute pain, oftentimes patients or persons living with sickle cell disease engage in self-medicating at home, using the medicines that they've been given by their healthcare providers. They make their contacts with their healthcare providers in order to ensure that they're able to manage that pain at home. And they make those contacts in many instances, requesting information on whether it would be necessary for them to come or not. But acute pain, you can have acute pain in any place in your body. You know, we used to think it was just in bones, but we know that, you know, people have acute pain all over their bodies. Okay, sometimes it's even a skin kind of thing where their skin is just experiencing major pain. Next slide. So let's talk about chronic pain. The International Society for the Study of Pain defines chronic pain as pain that lasts longer than 3 to 6 months, pain that remains after the injury or the illness is gone, pain that interferes with the daily functioning and quality of life, and pain accompanied by distress. So that's what we call chronic pain. Chronic pain is not limited just to sickle cell disease. There are many, many people all over the world who experience chronic pain for either sickle cell disease or for other reasons. But chronic pain is a very expensive pain that causes the U.S. and other countries much money trying to help people with chronic pain live the best possible life with it. It is very limiting. It's the reason for loss of jobs. It's the reason for loss of lives. It's the reason for loss of desire to live. And it's certainly something that we need to take seriously and work hard and ensuring that people in our arena, particularly sickle cell disease, get both treatment for both acute and chronic pain at a level that makes their life possible and makes their life better. So the emotional pain of sickle cell disease, let's talk a little bit about that. One of the patients said, because I had sickle cell disease and I looked like a normal person, my pain was dismissed. Many of you have experienced that same thing, that, you know, even when they didn't say you weren't in pain, they said that you didn't have the level of pain that you described, that you were exaggerating it because you wanted to make sure that they treated you in a certain way, that you got your pain medicines. And so this is something that happens regularly in the sickle cell community. I advocate for patients in the community, and I hear a lot about how they're dismissed and how people are not believing them. The hurt of minimalizing and discounting reports of sickle cell pain, you know, is not something that just happens every once in a while. It happens regularly. There are trust issues in our community and disbelief on the part of providers related to sickle cell disease and what you as people with sickle cell disease experience. It's a good day when you run into or encounter someone who believes exactly what you say in the sickle cell community. There's a lot of anger and disappointment over the level of treatment or the lack of treatment. There are repeated emotional wounds resulting in PTSD. I know we don't have a diagnosis within our community where we say that PTSD when we're writing a diagnosis, but when we talk about post trauma, you know, as a result of being denied what you need in order to live life with sickle cell disease, it lives in our community, and it lives whether people want to admit that it lives or not. We all know that the trauma of being accused of being a drug addict, or being refused care, or being sent home after you already waited for hours to convincing yourself to come to the emergency room, only to be turned around because people don't believe what you're telling them. It has a lot of impact on the lives of people with sickle cell disease. So why don't healthcare professionals believe sickle cell patients? Why do they have all these misconceptions and this lack of knowledge about sickle cell disease and who people with sickle cell disease actually are? So when we talk about that, we talk about the inability to validate by biomarkers whether someone is in pain or not, the absence of clinical tests that validate, they may see sickling on your slide, but validate your level of pain or the level of sickling that goes on. The stigma and the racial issues. We know that in the African American community and in communities of colors, we're often discounted and we're labeled as people who are drug addicts. When you look at the commercials on TV, and when they show you pictures of drug addicts, for years, drug addicts only look like those people of color. We now know that since we've gotten into the opioid epidemics, they're now showing pictures of young people who don't look exactly like us, who also are experiencing difficulty. But we are still thought of, and the perception is that people of color have more problems with drug abuse and are less likely to get treated in the way they should be treated. The perception of addiction lives in our community, even though we know that over time taking opioids that you get a tolerance and you may need more medicine to get the same effects that you previously got. People label folks with sickle cell disease as being drug addicts, of being addicted to opioids. There's a lot of implicit bias related to sickle cell disease. And because of frequent hospitalizations, you might go home one day and you're back the next day because, even though you thought you were better, you actually were not better. The ER visits, people think that we use the emergency room for sickle cell disease because we desire to get fast treatment, when we know that if you hit the emergency room, you're less likely to get rapid treatment. You're more likely to suffer in the emergency room. You're more likely to be discounted. We have physicians and patient knowledge deficits that live in our community. There are people that live with sickle cell disease who don't really understand sickle cell disease themselves, who suffer and struggle as a result of lack of knowledge. There are people with sickle cell disease who don't understand the exact purposes of the medicines they're given and how and why they should take it. There are physicians in the emergency room who know little about sickle cell disease. Many of you don't know that there's not major education within medical schools about sickle cell disease. And so people come out of medical school having a couple of hours maybe of information related to sickle cell disease. And so they're ill prepared to deal with people with sickle cell disease. And those kind of things visit you when you visit facilities that provide care to you. There is fear surrounding the opioid epidemic and drug addiction and drug overuse, and with a little regard for the fact that people with sickle cell disease, from the time they're born, they're born with the potential to have pain, and being born with the potential to have pain means that you're being born with the utilization of opioids and the development of tolerance and all of the things that go on with sickle cell disease. So clinicians and people with sickle cell disease, and also the people that surround them, live with a deficit of really understanding sickle cell disease and what it means to you as a person living with sickle cell disease. And so it really is up to you to do a lot of the education, unfortunately. And that's why it's so important for us to prepare you with information, because knowledge is power, and the lack of knowledge is suppression, is imprisonment, and it is life with sickle cell disease, a life that you don't want to live, being uneducated and not knowing how to speak for yourself or recruit others to speak for you at times when you really need assistance. Okay. So let's talk a little bit about the post-traumatic stress of sickle cell disease. And I just kind of decided on my own that people with sickle cell disease, after working with them for all these years, that they have to experience post-traumatic stress disorder. It's a disorder in which persons have difficulty recovering after experiencing or witnessing terrifying events. It causes intense emotional and physical reactions like pain, further pain, fear, anxiety, tension, anger, frustration, which lives in our community as we embark upon journeys with healthcare providers and even family members, and community about sickle cell, helping people understand. People, what amazing to me is that I was told by someone one day in conversation, well, I thought they cured sickle cell back in the 70s, and so they were amazed that we were still talking about sickle cell disease. And my response was, back in the 70s, we did have some provisions for caring for people with sickle cell disease, but we somehow went back to having less um, opportunity to receive good care than we did in the 70s. There was a focus on sickle cell disease then, and then all of a sudden there was little focus. I think because we got comfortable thinking that there was better care for people with sickle cell disease, and so we could feel that that would remain present all the time. And what we learned from it is that we have to always be vigilant with insisting upon improving things for people with sickle cell disease, that a little is not necessarily better. We need continual. So sickle cell disease patients continue to experience similar reactions when they encounter repeated episodes of hostility at the hands of healthcare providers, and sometimes it's not even hostility, it's ignorance. It's not being able to really provide the services that people with sickle cell disease need. It's denial of services. It's denial because you believe that things are better in the sickle cell community. And though they're a little bit better, we have a long ways to go in terms of actually providing what people with sickle cell disease need to have the best possible life. So next slide. So there are a lot of things that I really want you to take away from this presentation. One of the things is that we're not where we need to be, and that we have to continue to move forward to make sure that people with sickle cell disease get what they deserve. No one comes here saying that I want to be born with sickle cell disease. That's not the desire of our community. And so, and that not being the desire, we have to work harder at ensuring that we provide them with everything they need, and that we really engage people with sickle cell disease in a way that it's respectful, that it's honorable, and that it is that it promotes their getting their needs met, and that how we work together to ensure patients with sickle cell disease get the best possible evidence-based care. We don't want just care. We don't want just guidelines. Guidelines are not mandates. They just say what we should do. They don't make us do those things. And that's what I think people with sickle cell disease experience all the time. And we talk about evidence-based care. We talk about guidelines all the time, refer them to the guidelines. But until we finally can fight that fight where guidelines are respected, regarded, and implemented, we're still going to be in the same place. And so as a person who believes that, power is knowledge, I also believe that the support of people who have that knowledge is major important, so that we can change how people with sickle cell disease can live. And they're care directed at optimizing health while preventing physical or emotional damage or harm. Because we all know that every minute, when you wake up in the morning with sickle cell disease, because you have sickling present in the body, you have potential for further damage. And we have to somehow figure out how we can embrace and really care for people before they have all the damage that we wind up seeing them with in adulthood. I know that it's warm and fuzzy in pediatrics, but there are a lot of things. One of the things that I really have a pet peeve on is keeping people, having to keep people through pediatrics, and try and manage their care by healthcare professionals who are educated to primarily do pediatric care. We need people who are educated to do adult care, who can embark upon that, who can join us for that journey very early so that we prevent some of the damage that happens to people with sickle cell disease. And then how do we change the way each of us speaks and thinks about sickle cell disease and sickle cell and people living with sickle cell disease, giving them the respect they deserve. No more terms like frequent flyers and sicklers and drug addicts, but terms that surround people living with sickle cell disease and how we can help them to live their best possible life with sickle cell disease. So those are the kind of things that I think about when I think about sickle cell disease. I think about how I can empower our community, not just healthcare professionals, but families who sometimes walk away from people with sickle cell disease because the frustration of dealing with sickle cell disease becomes too much for them. How do we do this in a very different way so that we now can say that we're doing everything possible to ensure that someday we'll have a cure for sickle cell disease. And until we have that cure, that we can hold people responsible for the damage that they do in our community, and that we can move forward with intent and with hope and with direction and with care for people with sickle cell disease. So that's basically what I wanted to speak about. If there are any questions or if there are any comments, I think Carla, I'm going to just kind of just conclude by saying, I know that we can do it. We have to work together. We have to push evidence-based care. We have to optimize healthcare for people with sickle cell disease. And even after people get, quote unquote, a cure for sickle cell disease, they still have the damage of some of the things that have happened to them with sickle cell disease. We have to provide that emotional care. We have to provide that physical care that they will still need even after a cure. We have to provide education to people to understand that though they have a cure, they still have some catch-up things that they have to do in order to function in our society as a person with sickle cell disease. We have to turn on that light to help them to understand that sickle cell, though you don't have the physical part of sickle cell, you still have some healing to do. And so we still have much work to do. And so I just encourage you guys to be steadfast and to still embrace people with sickle cell disease and to give grace to them and to healthcare providers who don't happen to know as we try to educate and enlighten and inform. So thank you for giving me the opportunity to present again on sickle cell disease, and hopefully we can make this better.
Thank you so much, Ms. Pat. It was a great presentation. We do have time enough to take a few questions, if you don't mind, before we have our break. So
Okay.
one of the questions we had, someone asked, do you relocate? Do you relocate if you're not getting the best health care? As a sickle cell warrior, is it smart to relocate if you're not finding the best health care for sickle cell in the area you live?
So I would hope that would be the last resort. I would hope that if you have a community-based organization, that you engage your community-based organization, that you engage politicians, that you engage your spiritual community that surrounds you, because if you're not getting it, there's probably other people. So that you rally together to insist that a difference is made for you as a person living with sickle cell disease and your community that you are a part of. I would hope that would be the last resort. I know that that is a resort for some people. It may be what you have to do, but I would encourage you to do all those other things. The faith-based community can be phenomenal. Your community organizations, find that person who has a bigger voice than you have, you know, and engage them and making a difference for you.
Thank you. We do have another question. Someone asked about if they're having unbearable chronic pain, is the hospital the best place to be to go for that? An emergency room?
So if you have a doctor, whether you have a primary care doctor or a hematologist, you should really talk with them first. I think that you certainly, if you're having chronic pain, you need to find out who, what, when, why, and where of that chronic pain, so that you better understand it. What are your triggers? What works for you, what doesn't work for you. So even with engaging with your providers, you need to be informed and have the information to give them a description of what that chronic pain looks like and feels like, and show how it shows up. Does it just suddenly happen? Does it happen after something that you're doing goes on? All of those kind of things. I would think that if you have chronic pain, you don't just go, because chronic pain is something you have often or all the time. But if you're having acute pain, which means short-acting pain, something like your vaso-occlusive crisis or something new and unusual, yes, I would say go to the hospital. If you're having chronic pain, I would say that you work that out with your provider, so that they may have to change your medicines to give you a longer-acting medicine. They may have to send you to physical therapy. They may have to send you to some other modality to ensure that you get what you need in order to manage that pain. Chronic pain is different than acute pain. Acute pain is short acting. It's treated, you get better. You go home, you live your life with sickle cell disease. Chronic pain can be something that really interferes with everything you do. And so you want to get on top of that chronic pain very early, so that it doesn't continue to build and get to a point where you can't get the relief that you need. Okay?
Yes. Well, thank
So
you. Thank you so much, Miss Pat. You are
you're
just
welcome.
awesome. It was a great presentation. Everyone said that, hand claps all around. Great presentation, so much. And thank you so much for doing this presentation.
You're
It's
welcome.
very important to learn and educate the community on topics like this. So thank you very much, Miss Pat. I love your glasses.
Thank you. I can't read without them, so I have to have
Well,
them.
you are rocking them glasses, Miss Pat.
Okay.
Yes. Thank you.
Thank
Um,
you.
So you guys, please don't forget that you can go to inside the Hoover app and engage. If you guys come up with any questions afterwards, if you could message Miss Pat directly inside of the Hoover app. Make sure you start discussions. One of the discussions types that someone can start and get points for is, how do we as advocates um, help overcome the disparities of the invisible condition of sickle cell being an invisible disease? Someone write that down and put that in the chat and get the points. Engage, 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 as Carla says. So please make sure, because our top winners our top two winners, first place will get a $50 Amazon gift card, and the second place will get a $25 Amazon gift card. And we are also having the photo contest. Please do not forget. We know how everybody likes to take selfies. Make sure you're taking selfies and you're posting them in the photo for the photo contest. First place is getting $40. Second place is getting $25 Amazon gift card. So make sure you guys are participating in that and engage, engage, engage. Meet people, go say hello. And we are going to be taking a break, you guys. Yep, we have a break for about 15 minutes. And so we are going to be heading back inside. So remember, when you exit out of this, you have 15 minutes. Get up, hydrate, stretch, and then you're going to join us back at 2:45 for our next session. So please make sure you're back by 2:45. And to get to the next session, go inside the agenda, go inside the Hooper app, go to agenda, and then look under Friday at 2:45. It should say live stream, click it, and you're able to go inside there.
So we had a little change this afternoon. Thank you so much, Ms. Pat. We appreciate you so much. Our advocate extraordinaire, nurse in the community. We thank you so much. Thank you, thank you, thank you. We had a little change in the schedule. We had Dr. Weir that was going to present, but he had an emergency. So we are going to have a conversation about advocacy, and we invite you in to talk about why advocacy is important in our sickle cell community. And we look forward to chatting. So see you back soon.